As a pediatric dentist, I'm mostly working with families, and so a lot of families will ask me, how do I brush my child's teeth? When do I start brushing my child's teeth? And they'll also ask me, okay, if they have a cavity on their baby teeth, why do I care? Aren't they gonna fall out? And that's, I think, really where my job begins. Childhood tooth decay is, in fact, one of the greatest health issues that affects children today. In fact, it's more common than asthma and obesity, but those two things oftentimes make headlines a lot more often than tooth decay. I always want to go over with parents that the child's teeth are a part of their body, and we take a lot of time with diapering and changing and making sure their bottoms are clean, but in fact, our mouths are just as dirty as our bottoms, and so I work with families on prioritizing brushing and flossing their children's teeth because our teeth play a really important role in how we speak, how we function, how we eat, and how we even breathe and the tongue position in our mouth. One of the primary roles of a baby tooth is saving space and functionality for the adult tooth growing underneath it. Meaning that if we were to prematurely lose a baby tooth, the adult tooth that's growing underneath may not have space or availability to grow into the mouth. So I always remind parents that their role in their child's oral care is far more important than mine. They see me a couple times a year, but they see their child every single day. First and foremost, I want families to work on establishing consistent brushing habits at home, as well as flossing. If a child is very young and still breastfeeding or bottle feeding overnight, after a feeding, briefly wiping out the mouth with a burp cloth or even a dry toothbrush, anything to help remove some of those milk sugars from the teeth. Second would be to establish good oral habits in terms of their eating. Cavities are not formed by how much sugar we consume, but how frequently we consume it. So partnering with parents to say, okay, your kid's a big juice drinker. Let's try to have juice only with meals. That way they're focused, they're sitting in one place, we drink it, and we're done. I oftentimes have families say, gosh, I didn't even think about crackers as a source of sugar, but they can cause just as many cavities as candy. And so working with families to say, okay, if we're gonna have goldfish, can we also pair that with maybe some water and some protein so that they're less likely to cause cavities with time? The third is where I really come in to help. We don't want to go to the dentist only when there's a problem. We want to go on a consistent basis to prevent problems. And so establishing a child's dental home very early on is ideal. The current recommendation is either by 6 months or by that first tooth or first birthday. When I have a parent who obviously feels they're here too late, they feel guilty that their child is in pain, I always remind them, but you're here today. You made the change. You're here and you know you need the help, and I'm here to do that for you. So we're not gonna start at a place of blame or worry. We're just gonna establish, I'm your dentist, you're my patient, and let's move forward. What I would say is if any part of this video, my chat, has caused you interest in the dental field, please look into ASU Online's pre-dental concentration program. I think it's a great way for you to explore whether or not this profession is something you'd be truly interested in and a career path you'd wanna make your own.